Now, the next one we want to talk about, and the last one we want to highlight this morning, has to do with surgery, Operation Safe Surgery. Last year, 80% of the acute care hospitals in this state indicated their intention to implement the World Health Organization's Safe Surgical Checklist, a tool that's been proven to save lives and prevent complications during and after surgery. All right, so we have a special guest for this session today who wasn't able to join us. His schedule didn't permit him to be with us in person, but he did send a message to share with the audience, and I want to cue that up for you at this point.
Hi, I'm Atul Gawande. I'm a general surgeon at the Brigham and Women's Hospital up here in Boston, where I'm coming to you from. And I'm also an associate professor at the Harvard School of Public Health and Harvard Medical School, where I've done work with the World Health Organization directing a global effort to improve the results of care in surgery. It is the Safe Surgery Saves Lives program. I've been getting to watch what you've been doing in South Carolina in improving the safety of care and really setting a standard for it in a few key places. I know about your work improving well, really reducing infections from central lines and intensive care units by 30% by implementing the central line checklist. I know about your work where you've managed to become the second best state in the country for ensuring that heart attack patients get to a cath lab within 90 minutes of arriving at a hospital with a heart attack. I know that you've also been able to implement in every hospital a rapid response team that can be called by a patient or family simply indicating that they have something terrible going on for which they would like a rapid response. This kind of work, I think, makes your state a really special one to work with. And I am coming to you because South Carolina has been selected in the program that we're running to try to really raise the performance of surgery around the entire country by starting in one state that can demonstrably improve the safety of surgery to the point that we can measure reductions in serious complications for patients undergoing surgery throughout an entire state. And we came to South Carolina because of your track record in what you've done in other quality initiatives, and also because of what you've done with Operation Safe Surgery, which you started. In January of 2009, we published the results of a study we did in 8 hospitals around the world, ranging from Seattle and London and Toronto to Tanzania, India, and Jordan, where we brought a kind of pilot's checklist for surgical teams that you all have gotten to know about, the WHO Safe Surgery Checklist. And we had designed this to be a checklist which could be run at right before anesthesia, right before incision is made, and then before the patient leaves the operating room to make sure some key steps have happened. Steps like making sure blood is available for high blood loss cases and fluids and IVs are appropriate, to antibiotics, and then some interesting things, making sure that the team has introduced themselves to one another at the start of the day and that they understand the surgeon's plans for the operation, how much blood loss they should be preparing for, that they understand the anesthesia plans and the medical issues for the patient, and that the nursing team is really set with equipment needs and other concerns for the patient. This checklist, when we implemented it, reduced complications in every hospital that we tested it in. The average reduction in complications was more than 30%, including in the 4 hospitals in the wealthiest parts of the world. We have since been testing it in multiple hospitals, and where teams have taken it seriously, they have consistently reduced their complications by substantial amounts. But we have not demonstrated that we can change an entire population's expectations of surgical care. And so we've come to you, who in Operation Safe Surgery, immediately after the publication of our results in January 2009, within months, you all had 80% of your hospitals that had agreed to and then actually proceeded with trying the checklist in at least one operating room. Multiple hospitals in South Carolina have now adopted the checklist as their standard of care. We would like to work with your state and have already come to agreement with the South Carolina Hospital Association to try to bring this to 100% of surgical patients in the state. Bring this basic bar of safety to all the hospitals in a way that hasn't really been done across the country. And then, when we've learned how to do it across an entire population like South Carolina, we would like to work with you to be the model for the rest of the country, showing how other states can do it well. This involves a couple of steps. One is learning with you how to make it possible to try something which is a real culture change, to have some checks in place for surgical teams so that they really function like teams. And second, to have those checks be followed so well that we actually see and measure reductions in harm. We think we can do this at the population level, and yours is an extraordinary state to partner with because of the progress you've already made. I know that Dr. Mike Rose at McLeod Regional Hospital has agreed to help drive this effort and formulate some of the plans so that by the end of 2011 we could see 100% of South Carolina surgical patients, all 700,000 who receive inpatient operations and upwards of 500,000 who receive outpatient operations, that we could see them all be able to count on a basic checklist demonstrated to reduce harm for them. Thank you again, and have a great conference.
I want to acknowledge that Dr. Gawande is like Peter Pronovost, a physician who is emerging as a public policy leader as well as a clinical leader in this country. And the fact that some of these physicians are looking to our state as a place to begin the rollout for the country is really a compliment to the work that you're doing.